Hello, my name is Dr. Dewan S. Raja. Today I will discuss about precocious puberty. Precocious puberty is defined as sexual development occurring before 8 years in females and 9 years in male. So that if the girl has menstruation, the first menstruation menarche, before 8 years, that is a precocious puberty sign. In case of male, if the testis is large to merge and the male sexual organs are larger at 9 years, then that is also an example of precocious puberty. Incidence is about 1 in 5,000 to 10,000. Females are affected more than males. Physical findings in females: breast development, the initiation we call it thalarchy, pubic hair development, also axillary hair development, accelerated growth, and menarche, this is the first menstruation before 8 years. Physical finding in male: increase in testicular volume and penile length, axillary and pubic hair growth, accelerated growth of the body, muscular development, acne, change in voice, and frequent penile erection. These are the features of precocious puberty in male. What are the causes of precocious puberty? There are many causes. Sometimes we don't know the cause. That is idiopathic. One of the important causes is adrenogenital syndrome, tumor in the adrenal cortex, congenital adrenal hyperplasia, neurofibromatosis, tuberous sclerosis, McCune-Albright syndrome. Congenital adrenal hyperplasia may be associated with precocious puberty as well as genital ambiguity, especially in female. McCune-Albright syndrome may be associated with other features like dysplasia of the bone. There may be hyperthyroidism and precocious puberty. Gonadal tumor, CNS pathology, tumors in the brain, hydrocephalus, excessive accumulation of cerebrospinal fluid, ventricular cyst, especially in and around the third ventricle of the brain, hematomas of the hypothalamus or hematoma affecting the hypothalamus, thyroid dysfunction, hepatoblastoma, exposure to exogenous sex steroid like testosterone, or getting in contact with oral contraceptive pill, or getting food, that food is raised in animal, injected with estrogen. Okay. Post-traumatic head injury, and certainly idiopathic unknown cause of precocious puberty. Adrenogenital syndrome is one of the causes of precocious puberty according to Guyton's physiology. Some other physiology book just mix adrenogenital syndrome with that of congenital adrenal hyperplasia. Okay. So both the cases there will be precocious puberty because the target organ are the genital organs. In adrenogenital syndrome, pure adrenogenital syndrome, we have tumor of the adrenal cortex, maybe a tumor in the zona glomerulosa or zona reticularis, excess secretion of androgen, a cause of precocious puberty. Okay, it may happen both girl and boys. Female may have adrenogenital syndrome with virilizing effect like large clitoris. Sometimes it looks like a penis. Growth of beard, much deeper voice, and masculine body in the female. They have adrenogenital syndrome. Adrenogenital syndrome in adult male may be obscured by their natural virile factors. Laboratory tests and imaging studies. We have to test the gonadotropin releasing hormone testing, studies for 21 hydroxylase deficiency, specifically if we think about congenital adrenal hyperplasia. In congenital adrenal hyperplasia, the glucocorticoid, mineralocorticoid, or both may be suppressed, but there is excess production of androgen. That androgen target the genital organ, so genital organ may be enlarged prematurely. It is a cause of premature puberty, or we can say precocious puberty. It may be associated with genital ambiguity, especially in female, in congenital adrenal hyperplasia. Okay, in adrenogenital syndrome, if you have a tumor in the adrenal cortex, we have usually high level of 17-ketosteroid. It may be around 15 to 20 times higher in the male. Sex steroid study, we have to study the sex steroids, thyroid function test. There may be hyperthyroidism, even there may be some hypothyroidism under certain circumstances. In McCune-Albright syndrome, there is hyperthyroidism. Imaging studies for CT scan or MRI of the brain to find out any tumor, any hematoma, any fluid collection. Pelvic ultrasound to evaluate cyst. It may be ovarian cyst or the tumor, maybe ovarian tumor, maybe gonadal defect or disturb or variation in the gonads. Abdominal CT or MRI to find out any pathology in the abdomen. So treatment for precocious puberty. There is no acute therapy for precocious puberty. So a physician should have good communication and psychological support for the person with precocious puberty. Therapy depends on etiology. Suppose in case of 21 hydroxylase deficiency, or in case of congenital adrenal hyperplasia, we need to suppress the androgen, we need to replace the glucocorticoid or mineralocorticoid or both. Okay. Leprolide for central or gonadotropin dependent precocious puberty. This is a gonadotropin releasing hormone agonist that work in that way. Treatment of hypothyroidism and also hyperthyroidism. Whatever may be present, not only hypo but also hyperthyroidism. For male gonadotropin independent precocious puberty, androgen synthesis inhibitor like ketoconazole, testosterone, or aromatase inhibitor like spironolactone. Okay, so ketoconazole, testosterone, that is aromatase inhibitor, or spironolactone, that is an androgen inhibitor that may be used. So treatment for not only for hypothyroidism, also for hyperthyroidism. What is present in that patient? Okay, and that's all about the precocious puberty. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.